I am Dr. Hemant. I work as chairman in Orthopedics in Marengo Asia Hospital. Today I'll be giving some information about what is the hip blood supply damage. Right? After Corona, so many patients have come. Now, this is a ball and socket joint. This is a hip joint. It really moves wonderful in all the directions. This has a blood supply which can get damaged. That's what you need to know. 70% of people have a blood supply damage without any cause. That is why we call it idiopathic. Idiopathic meaning we do not know the cause. There are some patients who have taken steroids. Either a doctor has prescribed them for some life-saving, as a life-saving medicine, or the worst is I've got some patients who are bodybuilders or who are thin built and they want to gain weight. Unnecessarily they Google on the internet and pick up the steroids or take some protein supplements which are not good quality. That can cause a damage. Now this damage can be seen only on the x-rays in the late stages. But if you have a pain which is in this part of the hip, in the groin, and you think about the pain, please go and see your doctor. He will advise MRI scan. The MRI can grade the damage in the hip joint. So if you come to us early, we give you medicines which may slow down the process or even stop the process. Then in the early stages, if you have pain, we have techniques where we can do a release of the pressure called core decompression. But nowadays, we can take stem cells and put it there. But after this surgery, we don't allow you to put weight on that leg for 6 to 8 weeks. Unfortunately, vast majority of patients have on both sides. So it is very difficult for them to be non-weight bearing. And when the hip is damaged to an extent where this ball becomes completely flat and this socket is damaged, then we have to offer hip replacement surgery. Now it's not a bad surgery, but of course a natural joint which nature has given you, which God has given you, is always going to outperform than any other human being joint. Thank you.